This presentation will talk about endodontics and root canal treatment. Root canal treatment is required when the cavity is so deep that it reaches the pulp of the tooth, usually causing an infection at the tip of the root. This is called an endodontic abscess. Once the infection has been brought under control, the area around the root begins to heal. This usually happens once the dentist goes in and removes the pulp of the tooth. After the tooth has been cleaned, the canals in the root will be filled with gutta percha. And finally, once this is complete, the tooth will be crowned. So the procedure for a root canal treatment begins with a signed consent from the patient. The doctor then anesthetizes the patient and begins the RCT procedure. The doctor may ask you for a few PAs during the procedure. However, if he doesn't, it is important and mandatory for you to get one X-ray when the procedure is completed. This is called a post-op RCT X-ray and is required for the insurance. It is also important that you verbally give post-op instructions to the patient and also email the same instructions to the patient. Next visit after an endodontic appointment could either be completion of RCT or crown. There are a few things that may be different between RCT appointments on patients. Always read the sticky notes prior to starting any treatment. In some cases, when the infection is very large, the patient may only be able to complete the initial half of treatment. This is called an RCT start, in which the doctor opens the canals, removes the infected tissue, and the healing process begins. An RCT start is where the nerve has been removed, usually an antibiotic is given, and the healing process has begun, but the procedure has not been completed. The patient returns in 2 weeks to finish the RCT finish appointment, in which the canal will be filled and the tooth will be prepared for a crown. In most cases, patients will need a crown after root canal. This is because once the pulp is removed from the tooth, the crown of the tooth becomes brittle and has to be protected by placement of a crown. If a crown has been proposed, then that would be the next visit. Please confirm with the doctor and have the doctor discuss the options with the patient. Here is a picture of an RCT kit. It consists of multiple things, so please make sure you have all of this available to the doctor before the RCT treatment has begun. Thank you.